Welcome to the American Hospital Association special podcast series, Just Lead, a look at how hospitals and health systems that have been recognized with AHA awards for innovation, collaboration, and health equity are transforming healthcare to better serve their communities. The results have been encouraging. I'm Tom Hedderly with AHA Communications. Today we are joined by a finalist of AHA's 2022 Quest for Quality Prize, WellSpan Health in York, Pennsylvania. Hospitals and health systems are encouraged to apply for the 2023 Quest for Quality Prize by October 21st. Learn more at aha.org/questforquality. Let's join Nancy Foster, Vice President for Quality and Patient Safety at AHA, as she explores the great work of one of this year's finalists.
We have with us today Mike Syme from WellSpan. WellSpan was a finalist in the Quest for Quality Award, and we found so many delightful things going on at WellSpan that we wanted the whole world to know about. So I'm glad that Mike can be with us today to inform us about how they achieved this high honor of being a Quest for Quality finalist. Mike, good to have you here. Let me get started by just asking you to tell us a little bit about WellSpan. Give us the thumbnail sketch.
Thanks, Nancy, for having me. So WellSpan Health is an integrated health system in South Central Pennsylvania. We serve approximately 6 counties across South Central Pennsylvania. We have 8 hospitals. We care for over 1 million people a year. We have the largest behavioral health hospital and inpatient units in the state of Pennsylvania, and almost 2,000 providers and a physician network as well.
Pretty big system in a very interesting area of the country, both rural and with some urban inner city kind of activity as well. Tell us a little bit, please, about why you think the Quest for Quality Award Committee selected WellSpan Health as the finalist this year. What is it that you're doing? What's the secret to your success?
Well, we actually approach quality in a very strategic way in that we spend a large amount of time implementing a lean management system so that we could be able to have a plan for addressing quality and safety. That starts at the highest level of our leadership with our board, and we actually cascade our goals down to frontline team members so that every one of our 20,000 team members are actively engaged in trying to improve the safety and quality of our patients and team members. So for us, it's setting measurable outcome goals that we really strive as an entire team at WellSpan to achieve. And they focus on making our community where we all live and receive care a safer place. So that's really what our focus is.
That's great. So bring that to life for us a little bit. Can you give us an example from, say, the recent pandemic or other activities that you're engaged in? How does that work in driving quality forward?
So our boards, at the start of every fiscal year, we build our annual plan based on where we want to be in 5 years. So in the last year, we looked at how do we improve our overall health of our patients, which was one of our large goals. And that we really focused on improving our compliance with HEDIS measures and proactive screening. So when we set our goals, we not only set them for our community, but then we also look at it from a health equity perspective. So we set a goal to also improve the care we provide all of our patients across South Central Pennsylvania. So this year we set a goal to improve our overall HEDIS screening for breast and colorectal cancer. And we said we were going to improve it by 2 to 3% depending. We actually exceeded it by over 5.5% despite the COVID pandemic, but it was really because we all had this shared mission to improve access and to really look at saying how can we drive to provide better and safer care for our patients. But then we also looked at our diverse population. So we also had a unique initiative, and with breast cancer screening, we actually closed our gap by 25% in 1 year because it was a focus. So really it started with our board setting the vision that we are going to be a leader in health equity and we are going to be a leader in providing the safest care. Our CEO, Dr. Roxana Gapster, she brought the vision with her about driving to success in our communities, and that's to provide an environment where we can help our population, our friends and neighbors, obtain their best health possible So we've really set outcome-based goals for that.
It's unique. When I talk to many hospital leaders, they will point to the CMS quality measures as sort of their guiding light during their work on quality. But you've really pointed to the HEDIS measures that take us outside of the organization's four walls and really bring that population health perspective to it. A very deliberate choice, I assume. And tell us a little bit about how you engage then the quality improvement inside the hospital. Is it also focused on the HEDIS measures?
Well, so we have separate measures for our hospitals. So we really are striving to, achieve all of the areas highlighted in the CMS program. So readmission reduction, healthcare acquired conditions, value-based purchasing. So those are really specific goals that you can focus on. So that is equally as important. But as an integrated health system, we really feel like we have to focus both on our inpatient settings. We know that hospitals are a place where the vast majority of people get better, but we know there's a risk of harm. So we're constantly working on that. So we did also set an outcome measure goal for that. So in Pennsylvania, we report all of our serious events to the state. We set a goal to reduce our serious events by 10%, but we actually, by using data to identify what our biggest gaps were, this year we reduced it by 50%. So we actually, across our health system, we have seen a tremendous increase in the number of events that our patients and our team members are reporting as potential safety events. But we've actually seen a decrease in serious events because we're asking people to go to a more proactive approach to quality and safety, where they're looking to identify harm before it ever reaches a patient.
Wow. That's really interesting in light of the fact that the data that are now coming out suggests that there's been a retrenchment in safety activity over the last 2.5 years as people struggled with workforce, struggled with the pandemic. Remarkable that you were able to reduce adverse events so dramatically. Half. That's incredible. Could you give us a little bit more? How did that happen?
So we went to a team-based approach. So I'll use central line associated infections. One of our hospitals was an outlier for having too many. So we swarmed it. We actually had our infection prevention, nursing, quality, process improvement team swarm the situation. And really they focused on, just following best practices. So one of the problems with COVID was that people had to wear PPE. They didn't go into the room as often. They had to going in and out of a room took on a whole nother breath when you had to put on all of the PPE. So we really realized that was most likely contributing to infection. So the teams worked together. They really hardwired how to do the checklist for central line infections. And a hospital that had was an outlier for infections. They're almost at their 2-year anniversary for their last central line infection. And it's because they've really stuck with following the standard work. And they've engaged the entire team. That's the key part of it. Every single person has to be engaged in quality. Frontline team members, our food services, housekeeping, every single person owns all of our infections.
That's a tremendous bit of information for everybody listening to this. I'm really curious, Mike, as you were talking earlier about the work that you're doing in the community, the focus on well-being across the entire population you're trying to serve. Could you give us a few examples? Because I know your communities are very diverse. Talk a little bit for our folks about how you're working on it and how you have partnered with maybe some other organizations to achieve your goals here.
So WellSpan is the largest employer in South Central Pennsylvania, and we have a responsibility to our community to be a engager, to be a coordinator of services. We actually have invested in a lot of the larger coalitions. So really working with our federal qualified health clinics, really working with the Housing Coalition and the Food Coalition to try to bring people together. We found that when we start a program or build people together, there is a natural desire to grow them and to engage other areas within our community. So we started a gun violence program at one of our hospitals, and now it's working with the police department, Credible Messenger, one or two other nonprofits to try to build a mentoring program. So Really, it's about bringing people together, facilitating, but it's also for us about going into the community and listening. So with the vaccination program, we had to understand why there was vaccine hesitance with COVID among different populations. And then we actually engaged our community of WellSpan to actually go in and really have ownership of going out and talking to their friends and neighbors to really drive the safety of vaccinations. So I would say it's more about listening and being a facilitator and engaging with your community and building and starting to build more trust so that when we call and say, hey, you need your colorectal cancer screening, it may not be WellSpan. It may be someone from their community or their social circle that's telling them, hey, have you been screened?
For many people who know that area of Pennsylvania, it's also interesting that there's a large community of plain people around there, Amish, Mennonite, go by many different names. How have you worked with that community?
So we have an entire department that works with our plain community. So we partner very closely with the bishops. We understand that the bishops within the community are the most influential people. So even going back 20 plus years, we realized that just standard payment wasn't going to work. So we actually created bundles for care prior to bundles being popular. And it was really about being able to provide affordable health care to a diverse, unique population. We also, work with the plain community to provide care in a way that they are most receptive. So we have a clinic, a primary care clinic that specializes in plain community. We work with their nurse midwives or their midwife services to make sure that they can get the best possible OB obstetrics care. And then in our behavioral health hospital, we have a separate facility that just cares for members of the plain community. So everyone who works there is part of the plain community except for the physicians. And it's a complete hospital for behavioral health patients. It's a program that really expresses cultural humility, where we appreciate the uniqueness of their beliefs, and we try to bring that into their care community.
I love that phrase, the cultural humility. It sounds like, as you're describing the work you're doing across your communities, that you really are focused on getting outside of the four walls, meeting people where they are, and bringing them along in their health as they want to have that interaction. A really powerful way to move forward. What has been the reaction from the community to the work that you're doing? And do they know about the quality improvement work that you've done?
We are working very closely with our community. I think it starts with our board of directors. So we have an incredible board of directors that is very, very much a community board. So we have leaders who are running nonprofits, who've been leaders of some of the FQHCs. We have business people, but they all live in our areas. So they help direct us in building a health system for our communities. So we do try to share and engage with our communities opportunities to live healthier lives and prevent the need for healthcare. But it's, again, I said this earlier in the summit, health equity and improving health, it's a multi-generational program. So it needs to be built in such a way that it exceeds me, my successor, my successor's successor, because it's going to take 30, 40, 50 years to really eliminate healthcare disparities and drive our goal of providing the best possible health. So really, we need to build a program, and our board has been very responsive to that, that's sustainable.
Say a little bit more, because this equity work is so challenging for so many. Talk about a particular project that you might be proud of that people should know about.
Let's say COVID. We actually started and we had a large gap between our vaccination rates for our diverse patients and our white population. We actually were fortunate that 5 years ago, we made it a system goal to collect race, language, and ethnicity data within our EMR. So we're able to take every single quality measure and break down how we're performing as a health system and within each of our populations. So when we looked at our vaccination rates, we found that at the start, our white population was being vaccinated at a much higher rate than our diverse populations. So part of what we had to do is we had to go out and listen. So we set up many listening sessions where we actually had team members from our community go out into their own neighborhoods, their nonprofits, their community centers to listen. What were the reasons for vaccination hesitancy? And then we had to come back and figure out how are we going to address some of the misinformation that was being spread on the websites or on Facebook or other areas. So we did that, but then we enrolled a group of 1,000 volunteers, and we called them our Hope Squad. And they actually went out to all of the different nonprofits, community centers, churches, and actually started vaccinating there rather than in making people come into our clinics. And then we actually engaged leaders of the churches, these nonprofits that are so well known in our communities, and they actually were able to be the spokesperson to drive it. And what we saw was slowly our disparity decreased. And now, and we shared this with AHA, our Black population over the age of 65, they actually have a higher vaccination rate now than our white population. So we not only closed the disparity, but we increased the vaccination rate. And in South Central Pennsylvania, there is still a lot of hesitancy to vaccination, but we actually realized that by WellSpan taking a little bit more of a backseat to the advertising and being able to support and then provide the vaccines, we actually saw our vaccinations rates go up.
You're making me think back to the structure that Avitas Donbedian gave us to advance quality, right? You've built a structure with the community that builds on trust, and then you engage in whatever process is needed, whether it's COVID vaccines or it's getting people in for screenings for cancer or whatever. You're working with that structure in order to achieve your goals. And you're talking about very measurable outcomes that you've been able to achieve. Really remarkable work and a structure that will endure. As you were talking about, you can achieve 50-year change when you have that kind of structure. Tell us a little bit more. How did you reach out to these individuals? How did you identify those individuals in your communities that you wanted to partner with?
So unfortunately, it started because of bad experiences. So like many healthcare systems, 10 years ago, 5 years ago, there were issues that really weren't the best outcomes that we could ask for. And so part of the resolution that is we started having regular meetings. So our Vice President of Diversity and Inclusion, presidents of our regions, myself, we meet every month with key community leaders, and we have the difficult conversations. What's going well, what isn't going well, how is the community seeing WellSpan, and how can we be a better partner? And so through those monthly meetings that have been going on even before my time, we actually started that open conversation, and sometimes they're hard. But what it really did was it just made us realize what we could get better at. And it also allowed people and key influential people within our communities to be able to say what they need. So they share great experiences. They share experiences that they hear from their friends or neighbors that could have gone better. And then we just agree to continue to partner together to work on it.
Before I let you off the hot seat here, Mike, let me ask you about two issues that are plaguing so many of our members these days. One is about the resilience of the workforce. We know it has suffered during COVID. What have you done at WellSpan Health to really affect the ability of your workforce to show up every day and to be there in a way that is fully engaged?
It's probably one of the biggest challenges that's facing healthcare right now is the labor crisis that's happening. When we started with the pandemic, we really wanted to focus on communication. So we set up on the front page of our internal internet webpage, a COVID webpage that had all of the information. So every team member could go to it. They could see what they're doing. Because we have such a large behavioral health hospital and part of our health system, we actually deployed licensed therapists into each of our inpatient settings so that they could actually meet with, attend huddles, and really work in real time over the stress of what was going on with COVID. We continue to try to engage team members. We didn't give up on our quality measures. So we actually still set goals. We still strive to achieve them. And we really wanted to provide the setting that we're going to increase engagement. So we really, even though it was the middle of the pandemic, we implemented our lean management system. So we started to really have consistent daily huddles with each of the units. We actually wanted to share our goals. We created a tiered huddle system. So anything on a frontline unit could go all the way up to our CEO. And she leads a huddle every day so that we really work to connect our frontline to our senior executive leadership. So really, we focused on communication and just-in-time resilience work. We had every Monday, we offered resilient tips to our teams. And then, we really wanted to round. So leaders would go out and round in the units during the pandemic as well.
That's also a very important thing to have done. I know when our Quest for Quality team was visiting with you, we noted the fact that when you or Roxana walked onto the floor, people knew you. They greeted you, and sometimes they raised issues with you right there in front of us, which was great because they trusted you to have that interaction. It's really critical that we have that kind of relationship with our staff in this era and in any era in reality. One last question for you, Mike. COVID took us in many different directions. Tell us one thing that you learned at WellSpan Health during the COVID era that you think you're going to sustain now going forward as a new and innovative way to deliver care.
So I think it was our ability to pivot quickly. We actually raised new goals up and really we worked to rapidly address problems. So sometimes you can set a goal and you have a whole year to work on it. But the reality is there's some goals that you might have to complete in a week. And that really was the most impressive thing is when everyone got together and worked on something. And pre-COVID, it probably would have taken a year to do. And the best example is, we literally sent our entire workforce home in 3 days. We went from COVID, everyone working on site, to 3 days later, at least 60% of our non-care team were off site. And if you would have thought how long it would have taken us to develop a work from home program and connect everyone to Zoom and do all these things, it would have been a year plus project. And we did in 3 days. So when we put our mind to a goal and we work as a team, we can do remarkable things in a short period of time.
Well, and please help our listeners. I told you it was just one more question, but tell our listeners about your COVID experience, because it wasn't that you were in an isolated rural community and everything was just pretty hunky-dory most of the time.
So we did have lower vaccination rates, and during the Delta wave, we were inundated. So we have between 1,100 and 1,400 patients at any given time. And at the height of the pandemic, we had between 650 and 800 COVID patients in our hospitals. We also at the same time had 700 plus team members that were out with COVID. And so really what we had to do is we had to be creative. So we closed one of our hospitals, our surgery and rehabilitation hospital. We converted that to a COVID hospital. We really actually deployed team members to other areas. We went into some unique partnerships. So with Spirit Lutheran, which is a nursing facility, we actually took our LPNs from the clinic and transitioned them to provide care there so we could transition inpatients to Spirit Trust so that we could try to increase our capacity in the hospitals to care for people. We had to shut down our ORs and use those as ICUs. And we were fortunate that we were able to get the Department of Defense to send a strike team. So they spent 2 months with us. But again, it was everyone rallying around the crisis, people being willing to transition from a clinic setting to caring for patients in the hospitals. Our outpatient CRNA is actually going and doing ICU care in our hospitals. So really, it was the flexibility of our team member that allowed us to survive that event.
Well, Mike, congratulations on the award, but it was there because you're doing such remarkable work at WellSpan Health. We're really proud to have you as part of the American Hospital Association family and to hold up what you have been able to accomplish, not only through COVID, but over the history of your leadership and Roxana's leadership at the organization. We look forward to learning from you more as you continue to progress. And I really appreciate you taking the time today with us.